wonderful. So I want to introduce you to our first panelist. You would have met Dana in the webinar, which was before this Q&A session. Dana Blackwell is the Senior Director of Strategic Consultation and brings over 20 years of child welfare and public policy experience to her role at Casey Family Programs. In this capacity, Dana leads Casey's work in California, including statewide partnerships, initiatives, and systems improvement activities.
Good. Thank you, Jessica. Good morning, everybody, and welcome to part 2 of the fiscal and funding considerations for your Family First Prevention Services Plan. I want to start out by recognizing that it's complicated, right? That financing your comprehensive prevention plan is complicated. That's why we had over 300 people at the webinar a couple of weeks ago, and you all are back today with all sorts of questions. We will not be able to address every question that you have. It's complicated. But at Casey Family Programs, we endeavor with our partners to always think about how we can provide guidance, education, and support. And so over the course of your planning efforts, we will be thinking about how to continue to support you in thinking about how to apply the fiscal perspective to your planning. But today will be informative. We'll be able to provide you with a lot of information. You'll be able to dialogue with our subject matter experts. The second thing I want to do is remind you and put in a plug for next week's webinar entitled Building the Team, Prevention System Governance and Collaboration. That takes place on July 20th from 9 a.m. to 12 p.m. The learning forum will provide strategies for the work needed to meet the comprehensive prevention plan requirements for cross-sector collaboration and stakeholder engagement. We have an incredible panel identified for that webinar and Q&A session, and they're all from California, so I think it'll be great, and I want to encourage you to register. So let's get to it. Let me introduce our panel. You'll remember them from a couple of weeks ago. First, Don Winstead. Don is a consultant with over 10 years of experience working with states, counties, and tribes on child welfare financing issues. He is a former Deputy Secretary, Florida Department of Children and Family Services, and former Deputy Assistant Secretary for Human Services Policy at the U.S. Department of Health and Human Services. Claire Anderson, welcome. Claire is a Senior Policy Fellow at Chapin Hall at the University of Chicago. There she guides states using research evidence in large-scale system change. She has 30 years of experience at the federal, state, and local levels to support children and families. And today we're going to welcome Jen O'Brien, who is also from Chapin Hall, where she is a policy fellow. O'Brien provides implementation and capacity building assistance to multiple public and private child welfare agencies across the country. Today, Dr. Cooper will be our moderator. You will remember that Kush is an adjunct professor at the UCLA Luskin School of Public Affairs, as well as the CEO of Implematics, a consulting firm serving public and private organizations in the areas of foster care reform, LGBTQ youth and systems, implementation, science, and leadership development. Enjoy the rest of the session, everybody. Kush, I'm going to turn it over to you to get us started.
Thank you, Dana. Good morning, everyone. Thanks for joining us. I just want to outline for you how our morning is going to go. In about a minute, we'll dive into questions that we received before, during, and after the June 29th Learning Forum. And the general categories of questions you can see there: candidacy, maintenance of effort, what are some of the allowable activities with regard to FFPSA and other funding streams. We have some general fiscal questions. We'll talk about the state block grant and some questions that came up with regard to that. We'll be able to talk about the pair of last resort, sort of in general, from a principal level. And then there were questions about timeline and guidance that our colleagues at CDSS will answer for us. Our goal is to, even though we have collected plenty of questions from our prior gathering, we want to leave time for questions that come up today. And so at about 9:45, we will end the guided question and answer, and we will answer questions that are coming from you in the chat or if you raise your hand. At 9:55, we will go to the breakout rooms, and there are less breakout rooms where you'll be hearing a formal presentation, and consider them more like an office hour with our subject matter experts. In general, Don Winstead will be in the room discussing fiscal considerations, candidacy, and claiming. Chapin Hall will be in the room discussing evidence-based practices and particularly addressing a lot of the questions that came up around motivational interviewing. And I will be in a breakout room where we can discuss the various funding sources that have been talked about when folks have been planning for their comprehensive prevention plan and sort of how those shake out across levels of prevention. So that's how it's going to go today. I do want you to know the breakout rooms will be recorded. So if you miss one, you can listen to it later, and you'll be able to move back and forth between rooms. So if you got your question answered from Don's room, then you can move to Chapin Hall's room where Jen O'Brien will be answering questions about EBPs. And then if you get your questions answered there, you could move to me and go back and forth. If a question you asked has already been answered by the subject matter expert, they'll let you know that it has been answered, and then just remember that go back to the recording, and that's where you'll be able to get the answer to the question that you had. Right. So let us begin. Oh. There you go. This is what I just said. Now I'm going to stop sharing so we can see everyone and begin a dialogue. So the first couple of questions are in the area of candidacy. And Claire Anderson, I'm going to open with you. The question is, how does the new system track candidacy of the child of an expectant and parenting youth when the youth is in the foster care system already? So, as you know, Claire, pregnant and parenting foster youth are categorically eligible for FFPSA services. But this question is regarding to actually the child of that pregnant or parenting youth.
Yeah. So you've helped to answer the question, Kush. It is the pregnant and parenting team who is categorically eligible for Family First prevention services. So the data tracking that you are doing is of the teen. There is not a need to determine candidacy for the child. So this, you're really thinking about this through the doorway of the teen in foster care rather than the teen's child.
Great, thank you, Claire. Right, Don, I'll send the next question about candidacy to you. And as Dana said, it's complicated. So there was a request for more clarity on the discussion about traditional candidacy versus FFPSA candidacy. And more specifically in the question was whether families need to meet both to qualify for 4E reimbursement.
Yeah, and no. Let me suggest kind of a series of questions to ask yourself to get at that. Kind of question number one related to candidacy is, does the child meet the criteria for imminent risk that's in the state's Family First Prevention Plan? In other words, is the child at imminent risk according to the criteria in the state prevention plan? If the answer to that is yes, then the second question is, does the child's prevention plan include an evidence-based program that is listed on the clearinghouse? And if those two are yes, then the child is a candidate under Family First, meaning that the prevention service is eligible for 50% federal reimbursement from Title IV-E, and that the administrative cost, including case management, is eligible for 50% reimbursement and not subject to the discount rate that normally applies. Now, if the answer to that question about evidence-based program is no, then, and the child's prevention plan does not include that, then the next question would be, well, does the child meet the imminent risk criteria that are traditional, that existed before Family First? And if the answer to that is yes, then the child is a candidate under traditional 4E, meaning that you can't use 4E for the cost of services, but that the administrative cost, including case management, is reimbursable at 50% times the foster care discount rate. So as it has always been. But you would first want to consider Family First candidacy and only go to traditional candidacy if the Family First candidacy criteria are not met.
Thank you, Don. Very clear. And I do want to point folks to, there was a follow-up question in the chat about parenting to Claire, parenting teens include fathers. And if the father is in foster care, then yes, that father would be also eligible for FFPSA services. Thank you, Claire, for answering that. Right, moving on to the next question. Will at-risk families be able to access FFPSA supported prevention services prior to contact with a child welfare agency? So we're gonna drop a link to the draft California 5-year prevention plan. And it's a draft because California is in discussion with ACF on some feedback that the Administration for Children and Families had on the draft that was submitted, so it's not final. And I want to direct you to page 26 of that plan where it describes a community pathway. So California has elected to put in its plan the availability, should counties choose to opt to do so, a community pathway where contact with the child welfare agency can be significantly minimized. So what that could look like is that a local community-based provider does an assessment and makes recommendations for candidacy, as opposed to the child welfare agency making the assessment. Final determination of candidacy, the stamp that yes, this child is a candidate for FFPSA does lie with the 4E agency. However, the child does not have to have a child abuse report to be able to be eligible for FFPSA services. So the answer is yes, but there can't, given that we're going to have to do child-specific reporting down the road when we're ready to do so, there can't be a complete, the family cannot be completely agnostic to child welfare. No, to child welfare. Child welfare will have to, or the 4E agency will have to make the candidacy determination, but that doesn't mean that the child welfare organization has to have contact with the child or the family. I direct you to the community pathway section of our plan. All right, next question is on maintenance of effort. And Don, I'm going to put that to you. We're also going to drop a link to the slide deck from June 29th and slide 37. Slide 37 actually has a graphic that describes MOE. Don, the question is, what are the implications of MOE requirements on the ability to identify sustainable funding for primary prevention activities?
So a couple of things there, Kush, and first of all, step back and kind of what's the purpose of an MOE requirement? And what Congress was saying when they established this requirement was they wanted states not just to shift funds, but they wanted to expand the prevention services so that not only prevention services activities that were taking place before, but they wanted this new funding to be used to expand those. So that's kind of the basic principle of MOE. But it is limited, and it is limited in several ways. First of all, it only applies to specific funding sources, 4B, SSBG, TANF, et cetera, or if there's a state-funded program that may be applicable. Secondly, it's not everyone in the past. It applies specifically to federal fiscal year 2014 and only to those prevention services that meet all the criteria in the Family First Law. So were those evidence-based services as listed on the clearinghouse at the time that the state submits its prevention plan? Are these trauma-informed? In other words, do they meet all those criteria? So it's not any prevention service. It's a much more limited concept than that. And then at the time when the state and the federal government reach agreement on the Family First plan, it's a one-time calculation. So it gets locked in at that point, and it never changes. It never increases. So that the state has to report on it periodically, but it's a one-time thing. So once that's set, it is set. And so in terms of sustainability, once it's set, essentially don't worry about it from that point on. It is there. It is a known fact once it's established through CDSS. But then in terms of sustainability, it's not something beyond that, I think, that people have to be concerned about.
Great. Thank you, Don. And, we can, that's likely going to come up again in your breakout. So, if you have deeper questions about MOE, I recommend you go to Don's room.
Yeah, and I just say that at least in other states that we've worked with, some states it's zero because they haven't done a lot. But it's usually less than you think it would be, and when you apply all the filters. But again, that's a determination based on the information that CDSS gets from the counties. That's a determination that will be made there.
Thanks, Don.
Kush, there's a follow-up question in the chat from Paul Bennett. Does MOE equate to sustainability?
Don, what say you?
Well, I guess it depends on what you mean by sustainability. I mean, once it's established, it's established. And if you're able to provide services above that level and keep on, then it'll be sustainable. So I guess it is a known amount, and you have to provide, in order to get federal funds, it has to be beyond that amount. But once you meet that, then you just keep meeting it.
And Don, my understanding, and correct me if I'm wrong, is that having the evidence-based practices that are included in the MOE have to be those evidence-based practices that have been delivered with fidelity, like with fidelity as per the purveyor.
Sure. All of the criteria that would apply to prevention services going forward would apply to the 2014 calculation.
Great. Thank you. Claire, this is a question regarding, so what are some of the FFPSA allowable activities? You know, there's one part of the question that is, can funding be used for housing? So let's have you answer that one.
Sure. Family First prevention services are statutorily defined in 3 categories: mental health prevention and treatment, substance abuse prevention and treatment, and in-home parenting skills building. So those are the 3 categories that the clearinghouse is reviewing evidence-based practices and placing those evidence-based practices on the clearinghouse when it determines that it has met the level of evidence also set by statute within the legislation. So presently, there are no housing-specific interventions on the clearinghouse. So the only ways that you can pay for an intervention is if it is on the clearinghouse. So there are certainly researchers working to build evidence around housing as a strategy to prevent mental health problems, prevent or treat substance abuse problems. But presently, the evidence does not sit in a place that has allowed the clearinghouse to either review or place a housing intervention on the clearinghouse. Certainly, as states think about contracting with providers of services to provide an evidence-based practice, like a trauma-focused CBT or a motivational interviewing or a functional family therapy that are currently on the clearinghouse, there is no prohibition that you couldn't contract with an organization that is also providing some housing type supports, so that you are paying for the EBP provided by providers in a context that might involve housing. But
Thanks, Claire.
presently, there is not a straight line to pay for housing.
And then the next question regarding allowable activities is, does FFPSA pay for training for EBP programs for staffing that are going to be delivering EBPs?
Yeah, sure. Certainly, yes. There is an admin and training reimbursement component of 4E for standing up, delivering Family First prevention services. So so I think about this in 2 different ways, and Don will help me if I get this not in the right ballpark. I think about this in 2 ways. One is, if your staff, your 4E agency staff, is going to deliver an EBP, then training them, supervising them, monitoring them to provide the EBP is one way in which you would draw down training and admin dollars. Another way to think about this is that we also have to train the workforce to understand what EBPs are available for their families, how to select an EBP for their family, how to refer, how to help families stay engaged with the EBP, even if they are not providing the EBP. The literature is rife with information about how hard it is to get a family to an EBP, to get them to uptake the EBP, have them sustain for the entire time of the EBP. And so helping our workforce to be part of that facilitation process and to understand the EBPs and how to keep families engaged is absolutely part of what we should be thinking about training the workforce with as well.
And there's a follow-up question in the chat.
Sure.
Does the funding include training for providers, especially with respect to providing the services with model fidelity?
Sure. That is part of providing an EBP with fidelity is core to Family First. And the only way to provide fidelity EBPs is to train people to do that. So integrating that into contracts is also part of what states should be thinking about. But both in terms of like the training of providing the EBP, but there's also, as you will recall, for well-supported interventions and a CQI process, and for supported and promising interventions, an evaluation process. And that also has to be part of what you're thinking about as you're building in your cost modeling.
All allowable, all allowable. Yeah, great.
Dawn and I are both shaking our heads. That's a good sign.
Very good sign. All right, so Don, some general fiscal questions. One is, can you discuss the intersection between utilizing an EBP in a family's prevention plan and being able to utilize 4E? I mean, the answer may be in the question, but I think the asker probably wanted some confirmation and validation of that.
Yes, the evidence-based program is reimbursable by 4E. And let me step back just a second and remind folks what a big deal this is. Okay, because since the inception of Title 4E, since it was created in 1980, and even before that, when it was a component of the AFTC foster care program, ever since the beginning, then 4E or its predecessor program has not been able to be used for services. That was prohibited. So you could not use it for counseling. You could not use 4E for provision of services. That was, completely outside of the ballpark. And with Family First, now that changes. And if it's an evidence-based program listed on the clearinghouse, then it is 4E reimbursable if provided to a candidate or a pregnant or parenting foster child, then it is reimbursable. Now, there are some restrictions. If it's a promising or supported practice in the future, there will be restrictions that favor well-supported practices, but California's plan includes evidence-based programs that are all well-supported. So for all the things that are currently in California's plan, 50% federal reimbursement for evidence-based program, uncapped federal entitlement. Sky's the limit, okay? Now, two things I wanted to say. One thing that, backing up just to a minute for the sustainability question. One of the things to think about with sustainability, outside of or beyond MOE considerations is the whole idea of prevention services is to prevent entry into foster care. And for prevention services to be sustainable, ultimately that has to be successful. If you provide prevention services and you prevent entries into foster care, that is going to be sustainable. And if not, then you may have resource issues that you need to deal with. But the whole sustainability issue is, are you effectively providing prevention services to prevent entry into foster care where that can be accomplished safely? The other thing, just building on what Claire was saying about the admin and training, you can take administration and separate it into two broad subcategories: child-specific administration and non-child-specific administration. Child-specific administration, such as case management or assessment, development of the prevention plan, is from the first day of the month in which the child's identified in a prevention plan and going forward. For non-child-specific activities, which would include things like developing and training and policy development, developing the criteria for CQI, all of those kinds of things, is from the first day of the quarter in which the jurisdiction, the state submits an approvable Title 40 Family First Prevention plan going forward. So, you know, that's just the distinction there.
Thanks, Don. And there's a question about the sharing ratio and the discount rate, and somebody has very timely asked a follow-up question in the chat. So we'll get to both of those. So the question is, what is the federal sharing ratio, and does the foster care discount rate apply? Is the first part of the question, and the second part of the question is the federal share open-ended?
Okay, so the answer is 50%, no, and yes. So the federal matching rate is 50% for services, 50% for administration and training, not subject to the discount rate. Now, you know, for the discount rate essentially normally applies, and it is a ratio that is based on the number of 4E children divided by total number of children. That's an oversimplification, but that's basically the concept. And and for normal 4E foster care, you have to apply a financial eligibility test based on the 1996 AFDC need standard. So even though this is 2022, you got to look back and use the 1996 need standard that was used in the now defunct AFDC program. And the family of removal has to meet that financial eligibility test for 4E reimbursement. And the discount rate is essentially the percentage of families that meet that test, and also is the child in a 4E facility, licensed facility, and that yields a percentage. And normally for 4E, that applies then to administrative costs. So to the extent that it's you know, 4E eligible, then that applies, and that's why it's called a discount rate, because it reduces that 50% reimbursement. The AFDC financial eligibility standard does not apply to Family First. So it's, you know, once a child is a candidate or a pregnant or parenting teen who meets that criteria, then it's full 50%, not subject to discount rate.
And can I just add, kind of in plain language there, over the long term, Family First really does incentivize the provision of prevention services and increasing the number of families that you are serving on the prevention side of your front door, and anticipates not just a expansion in that space, but also a reduction of the number of children in foster care. So it is a dramatic reshuffling of the dollars and the opportunity to create a different kind of system going forward.
And I'll just say, and we can talk a little bit more when we get to the breakouts, but the question I'm seeing in the chat talks about how will we apply. We have a mix of families with the discount rate and families not. And likely in your cost allocation plan, you would define two different cost pools. And cost pool number one for Family First would be full 50%, and cost pool number two would be subject to the discount rate. So normally that's how you would deal with that.
Thank you. There's a question in the chat that I missed, and Claire, I'm gonna send that to you about EBPs. If California's plan doesn't include promising or supported EBPs, does that mean that there is no funding available to draw down for them because they're not included in our state plan?
Oh, no, not at all. Well-supported EBPs are available to draw down funding. In fact, the legislation preferences well-supported interventions over time in terms of the amount that you need to have in your plan. So you absolutely can draw down for e-funding for well-supported interventions.
Okay, and I'm presuming that if there were promising and supported EBPs,
You can also draw down
in the plan, we could draw down 4E. But if they're not in our plan to ACF, then even though we're providing them locally,
correct,
4E cannot be used. Something else would have to be used.
That's correct. What you put in your plan and how you negotiate what's in your plan with the Children's Bureau is very important. That is your codification of what and how you plan to implement Family First and how you plan to claim for those dollars.
And if I could add just one kind of to that once your plan is approved, you can amend it.
That's right.
There's no, so if you want, if you want to amend the plan going forward and add additional evidence-based programs to that, of course, that would be subject to approval, but there's no limit on how often or your ability to amend the plan going forward. In several jurisdictions that have started off have since amended their plans to add additional things.
Great, thank you. All right, we'll get to one more category, and then we'll open it up for questions. For questions that have been asked that we don't get to today, we're going to provide written responses and provide you all with a link to those within a couple of weeks. So we're not going to be able to get to anything today, but we will make every attempt to at least address, if not answer, all the questions that are coming in. So let's talk about the state block grant a bit. So there's a question about, can the state block grant be used to assist in the development of the comprehensive prevention plan through a consultant contract? The short answer is yes. The block grant activities that can be supported by the block grant include any delivery of any primary or secondary services that meet local needs, EBPs that are not included in California's FFPSA prevention plan, development of the local CPP, so that includes consulting to help develop that CPP, building of a sustainable prevention infrastructure, admin and training beyond what's allowable by 4E, cultural adaptations, evidence for building inclusion of evidence-based practices into the clearinghouse at some point. So those are all things that the state block grant can be used for. There's another question about what's the difference between the FFTA, the transition grant allocation, and the state block grant as to what funds can be used for. So there's a lot of overlap with regard to what you can use FFTA for and what you can use the state block grant for. So, the recommendation would be to be strategic about which you're going to use first and for what. You can use the FFTA funding for readiness assessments and gap analyses, creating a service inventory, determining funding sources and outcomes for existing services, building local capacity and infrastructure. So there's the overlap with the state block grant to establish, continue, or expand prevention or early intervention services to meet needs that have been identified as part of your local planning process, to evaluate evidence-based practices, and any transition activities. So this is specific to FFTA, transition activities for former waiver demonstration project counties to transition to FFPSA prevention services. The guidance, and we've dropped the links to the ACLs in the chat, After dedicating at least 50% of the transition grant funding for these Part 1 prevention or early intervention activities, counties can then use FFPA funding for any activities to support all parts of FFPSA. So that includes implementation of Part 4 and any other activities allowable under FFPA. So that is one difference, is 50% of your FFPA allocation can be used for Part 1 and 50% can be used for non-prevention related things. But in terms of the state block grant, that is fully prevention focused. Right. It is 9:45, and I am going to actually take the opportunity to open it up for questions. You know, if there aren't any, I'll launch into the remaining list we have, but I did want to leave time for this to be interactive and answer, you know, for those of you that actually took the time to make it worth your while to be able to ask your questions live. So if you have a question, go ahead and put it in the chat or raise your hand and we will call on you. Looking for hands, looking for chats. Seeing none, and I can't see everyone, so if somebody can let me, oh, there's one in the chat. So are the feds considering delinking foster care from this requirement as they did with adoptions? Don, you want to take that one?
Sure. And so just to remind folks, in adoptions, the feds laid out a multi-year plan based on the age of the child to delink eligibility for 4E adoption assistance from the 1996 AFDC requirement. And while there are certainly a lot of people who would love to see that same concept applied to foster care, I'm not aware of any realistic effort that is on the table now to do that. The problem is every time that gets discussed, somebody asks the Congressional Budget Office, what will that cost? And it turns out that it would cost a lot to do that. And that tends to scuttle it. Claire, any?
Yeah, I would add, and going back to my comment a few minutes ago, they've delinked it from the prevention component of 4E. So not applying the discount rate in this space is tantamount to delinking it. So 100% of children receiving prevention services are eligible once they've been determined a candidate and there is a EBP in their child-specific prevention plan. So in essence, Congress is very much pointing us in a particular direction. There is a theory of change here from Congress about the front door and the back door of child welfare. It is delinking and allowing for additional dollars spent in prevention, and delinking and allowing additional dollars spent in permanency, thereby squeezing only for those children who absolutely need it, the foster care component of this system. So as you think about where you want your system at the state level, at the county level to be 5 years, 10 years from now, in many ways we are applying that theory of change as tailored and individualized to each specific child, each specific circumstance, each specific county, each specific state, through this delinking mechanism in part.
Yeah,
Don, do you see the question in the chat? Yeah.
Yeah, as a follow-up to the question in the chat, there was also a question about whether or not this was open-ended, the funding and the 4E funding for prevention services, for prevention administration, for training, all of that is open-ended, uncapped federal entitlement.
Thank you. Right, there's another question. Thank you, Laura, for those questions. There's a question from Janet Robinson. Is case management for FFPSA eligible clients claimable under FFPSA, or is it only when overseeing the eligible EBPs?
Now, if a child is a candidate with an EBP in their prevention plan, then the case management for the case is claimable under Family First.
Thank you. What other questions do folks have? All right, I'll go to our next one. If I don't see any hands pop up, which I don't at the moment. So just Don, a couple of general questions about payer of last resort. Does the payer of last resort apply to local and state funding streams or only federal funding streams?
It primarily applies to federal funding. The idea of the payer of last resort was specific to Medicaid. Now, there have been questions as are there other things it could apply to, but essentially the Congress's intent in the new payer of last resort provisions was for prevention services that before Family First were paid by Medi-Cal, and the extent to which those could be paid for by 4E. So it is specific to that situation.
And you know, in terms of how this is going to roll out locally, DSS and DHCS are working diligently and collaboratively to develop a framework for joint guidance and joint guidance. So you know, that is forthcoming. We don't have a timeline for that, but from a more general perspective, how does it get determined on which funding source, FFPSA or Medi-Cal, will pay for services if both are pairs of last resort? And I think this is collapsing those two ways to think of pair of last resort. Right. And then if you could even just say something about, you know, the mantra that you say about if FFPS, if Medi-Cal could have paid for this child for this service before FFPSA, then it should. So if you could just go there for a bit, I think that'd be really helpful for our listeners.
Yeah, so first of all, payer of last resort depends on context. So for Medi-Cal, historically, Medi-Cal has been the payer of last resort for health services covered by Medi-Cal. So for example, if there is if somebody has private health insurance coverage and also Medi-Cal, then Medi-Cal pays after the private health insurance. So within the context of Medi-Cal paid services, historically for health services, Medi-Cal is the payer of last resort. 4E comes in, and the question becomes, wait a minute, what if it's a prevention services that's payable about 4E? And Congress said for that specific purpose, then if something would have been paid for by Medi-Cal before Family First, then it continues to be paid for by Medi-Cal after Family First. If something is a prevention service that is payable by 4E and would not have been paid for by Medi-Cal, or that family wouldn't have been eligible for Medi-Cal or whatever, then could it be paid for by 4E? Yes. So it is specific to that in general. So the basic concept is very simple. If Medi-Cal would have paid for it before Family First, Medi-Cal pays for it now. However, then you would say, well, what about this instance? What about that instance? And once you get past that simple concept, there are a lot of things at the margin that are things I think that CDSS and your Medicaid agency will provide specific guidance about.
Great. And we have a raised hand, Paul. Is that a follow-up to sort of what Don's answering now?
Right. So this is something that, this is something that has been concerning, and I don't think just to me, but for many others, for services such as FFT and multi-systemic therapy. And I can't speak, I'm with LA County probation, but if we're going to, I don't know if Medi-Cal would pay for those services. Does anybody know if Medi-Cal would reimburse for those prevention services, or which prevention services Medicaid would reimburse for? Is there anything specifically that we know of? I think that's an important question.
And I think that's kind of one of those local questions that DSS and CDSS, DSS and DHCS are working out. But Paul, the way I think about it is, if Medi-Cal is paying for it now, right, then it should continue to pay for it. If it's not paying for it now, there's a reason it's not paying for it now. And 4E can come in and address those reasons for those families in that geographic area that have prevented them from using a Medi-Cal funded EBP. Capacity issues, geography issues, etc.
So that leads me to, and I honestly just don't know the answer to this, that there are EBPs that are currently being paid for by Medi-Cal. Are there any? I mean, there are folks from all over the state here, I think. Are there any, and maybe this is for a breakout group, but are there any EBPs that are paid for by Medi-Cal?
Well, in Los Angeles County, and I wish Robert Byrd were here to talk to us, but there are in their prevention and early intervention program, there are EBPs that are being paid for by EPSDT right now, right? And so and I think that thinking, and I know DSS is sort of looking all over the state for examples of counties that have been using EBPs and how they've been funding them to then decide what the joint guidance is going to say about it. But I know folks are in that inventory as we speak. And more so, and it is more in the EBP breakout. Also, I'll point you there. It is 9:55. And I want y'all to be able to have a little more of an intimate experience. Regina, hi Regina. I did see your question about motivational interviewing, and that's going to be a key discussion in the breakout with Jen O'Brien who's with Chapin Hall. So I would recommend you go there and take that question with you. All right, so I'm going to share screen. And just show you again where the breakout rooms are, and a little note from our host about how, instructions on how to choose breakout rooms. So here we go. All right. So again, there you will get you will see if you go to your Jessica, do they have will it just pop up for them?
Sure. So right now on your screen, you should see the breakout rooms as they appear. If not, you'll go to the 3 dots at the bottom of your screen that say breakout rooms. You should be able to click that to see the options. In there, you'll be given options on which room you would like to join. There'll be 3 options there. You'll be asked to select, and your panelist will meet you in the room. I can see now that people are starting to move. You have EBPs, California funding and prevention levels. However, if you are interested in the fiscal considerations, candidacy, and claiming, you're going to remain in this room. You're not going anywhere. So the room that we're in is now going to be the fiscal considerations, candidacy, and claiming room. EBPs, you'll see that there's an option for that. And California funding sources and levels of prevention as well. If there is a room you're trying to get to and you cannot find out how to do that, please make sure to send a message in the chat to your host, and we may be able to assist. Panelists, I'm going to ask you to go join your room now as well.